I'm an acupuncture physician, massage therapist, homeopath, and herbalist. Today I'm going to show you how to do a synergistic massage using Ayurvedic, that's Indian, and then also Japanese strokes with aromatherapy. And then we're going to use some facial acupuncture and constitutional acupuncture to finish off. Now, as I said before, the first part of the treatment, the massage and aromatherapy, is really great for needle-shy patients, needle-phobic patients that have fear of needles, and just as an intro, just as an introduction to Asian bodywork as such. And this is one way of actually getting people to, get their vanities catered to, getting facial lifts and that. It doesn't take so long. There's no real medical procedure involved. Alright, first of all, we need to relax the client. And we can do this with aura stroking or feathering. So what I'm going to do now is I'm going to take my finger pads and I'm going to slowly put it on the one side, the left side, that will be the yang side, and I'm going to slowly just take it down. Just stroke down on the patient, grounding the patient. That's what I'm doing now. Then going to the left side, notice the hand holds, okay, finger pads, pressure is almost non-existent. Two hands, peel off the two hands, then do it singly, then down the ren channel. You can also reach across, move down, see, place the hand here, slowly move down. Notice that the speed is not in any way excessive, and it's the right feather touch. It's all energy work. Start over here, go down, all the way down to the leg. Now how many times? You should do at least 5 repetitions, 5 to 10. 10 if the patient is especially nervous, okay? Has a history of maybe anxiety, anger issues, things like that. That's the first thing that we use. Now the next thing is you're going to do the 4 gates. So the 4 gates, large intestine 4, Hego or Hoku point. And the trick is to place your thumb right there with the finger straddled underneath. Alright, first of all you might want to push to get a reaction a little bit, maybe 3 out of 10. 10 is the highest pressure, and if the client notices it, then obviously there's some issues going on. Again, I'm sticking to the left or the yang side, the emotional side. Very often, at the end of the day, there's a lot of emotional stress that's just bubbling over that needs to be released. Then, I'm going to go down the leg to liver 3, Tai Chong. Alright? That's essential. We're opening up the top, bottom, left and right. So it's a yin-yang combination all the way through. Alright? So here again, if you look at my thumb over here, I'm going to do a little bit of a thumb walk. And I'm going to slowly do this little inch tape thing, right where it's tender. And then I release the pressure. So then what do? I get comfortable, I can do the sitting down. And then I'm going to rotate using one thumb, and I can now rotate with my thumb to the left. Okay, from left to right, there will be sedating. My other thumb on large intestine 4 is static. I do that for about 20 seconds. I hold it. Then I do the large intestine 4 and I go and rotate. The pressure is almost non-existent. It's all energy work. Now bear in mind, if you're doing this, you have to be grounded yourself. You have to have a good track record, a history of doing meditation. If you are calm, centered, and focused, the client will feel that. It's your chi that's being used, and you're also tapping into universal chi or universal life force. You can do this for 1 minute per side. So locate, touch the 4 points first, Okay, first on the left side is emotional issues, and then balance off by going to the yin side, the right side. Okay? One way of remembering that is that women are always right, so therefore that's the yin side, and then men are always left out, that's the yang side. Okay, now when you disconnect, the operative word is disconnect. Take a look at my logic system 4. I'm going to slowly going to disconnect. There's no abrupt ending. Okay, we don't want to rebound. There's always energy still attached to your hands, and so it's like a string that you're just letting go. And then what you then do is you can just flick it out or give it back to the universe. Next, what you can then do is go to the center, to the trunk. Ring 12, conception vessel 12, and for example, yin 10. Alright? Again, this is a great way to initiate clients to a needle shine. Okay, so your thumb is on ring 12, and my other thumb is on yin 10. And now I'm going to, if you look at ring 12 on the trunk, I'm going to rotate. And I'm going to rotate from right to left towards you. I'm sedating. Left to right is tonifying. So first you want to get rid of the excess. And if fibromyalgia case, chronic fatigue, after you get rid of the anxieties, fears, frustrations, then you want to tonify. You want to repeat the procedure, opening up the full gates, and working on the trunk and going clockwise. Clockwise from where you are standing. That's important to note. So we're going to just rotate, and now static hold, thumb, hardly any pressure. Then if you look at my yin side, my third eye, I'm going to do the same thing. Okay, from where I am, I'm going to go from right to left. So the outcome is static, this one is moving. Okay? You can also move your hand, the palm of your hand, lob one point to do or governing vessel number 20. So you can just place it also, of course, on the 7th chakra. Okay? So here, of course, the client has moved down on the table. So let's imagine I'm doing the 7th chakra hold over here. That's actually in the phlegma. And I'm still holding ring 12. Very, very peaceful, very pacifying.